everyone, welcome to the channel. Thank you so much for tuning in. All right, so as you're aware, I'm a nurse and I've been in this game for a while now. I've seen the ups and downs in the profession. You know, when you talk about the highs of helping patients to deal with their problems, as well as the lows of dealing with difficult either clients or own colleagues. Despite all the challenges that I go through on a daily basis, or as nurses we go through, it is a very tough career, but I have no regrets about taking that leap of faith and started my nursing career. So I'm just going to share with you, just some things I wish I had known prior to starting my journey in nursing. So when I first started nursing school, I was like, I don't think it was going to be this hard, but at the same time, I was kind of thinking, what am I getting myself into? How hard it could be, you just show up, hold your hands, and you give your medications, and then you leave, and that was. Nursing is so much more than that. It is physically demanding, it is emotionally draining, and not to mention how exhausting it can be at times mentally. Nursing is not just about the patient. It is not about the patient care, but it's about the family, their loved ones, and also about yourself. Because if you're not taking care of yourself, it's not going to be good for the patients, all right? And it's not going to be good for you eventually. So one of the biggest misconceptions that a lot of times persons have about that is, nursing is all about the patient. And don't get me wrong, patient is definitely the most important part of the equation, but it is not the only part. You understand? You have to deal with your doctors, your support staff, and your own colleagues. And a million other people might think that, they know what is best for the patient. And so sometimes it might feel as though they're trying to get everyone on the same page. And that is just something that you have to get used to. Another misconception that a lot of persons have about the nursing field is that it is a 9-to-5 job. It is not. It's not a 9-to-5 job. It's a 12-hour job. It is a job that always requires you to be on your feet, always requires you to be available, and always be ready to jump into action at any moment. Don't even get me started on the paperwork, because even though you're going in and you're thinking that you're a nurse, sometimes I feel like you're a secretary. You understand? Because a lot of time there is so much documentation that you have to do. Documentation is such a huge part of the job, and sometimes it can be overwhelming at times. I tell you, it can be overwhelming. I thought when I was in Jamaica, I was working with papers, and then I come up here and I'm going to be using the electronic charting system. No, you have the electronic charting system that you have to work with on paper as well. All right. So a lot of persons just think that nursing is all about just doing vital signs and giving medications. But there is also us doing care plans. You have to communicate with families, and you also have to do procedures as well. And it's not easy. It's not easy. It takes a lot of skills. It takes a lot of knowledge, and you have to be compassionate about what you're doing. So when I started my career as a nurse, I was a little bit surprised about, the difficulty I was having with balancing my personal life and work life. And when you talk about leaving work on time, it's not that easy. The stress that follows you home as well, it's hard for you to turn it off and say, okay, then this is work time and this is family time. So you have to learn from very early about self-care. And if you never know about self-care from before, when you start this field, you're going to have to know a little bit more about self-care, because self-care is going to be very essential. Because physically and emotionally, you want to make sure that you are in the best shape for the long run. You don't want it to be a case where you're all beat out or you're all tired, exhausted because of the job. All right. So I was so surprised that the emotional toll that this job has on me, because sometimes I leave work and I tell you, I deal with people on a daily basis. You're dealing with people life, and sometimes it can be very heartbreaking. You understand? And so you have to kind of develop some thick skin and try to work under certain conditions. There are days when you really want to cry and you just have to kind of just hold it in. There are days you want to scream and ask, why is this happening? But you cannot do it. You just have to keep on going, because it is just a job you're doing. Self-care is very important, and even though it might sound very simple, you have to learn how to take care of yourself, because self-care is not about taking a bubble bath and taking massage. It's more about taking care of your mind, your body, and your soul. And it's about taking the time out for yourself. And even when you don't think you have it or you don't think you need it, it is very important for you to prioritize your own needs, even when sometimes you might feel like it is selfish of you to do so. Sometimes you might be there working and you find out that you hear a code blue, and sometimes you hear people just running around like chickens without a head. So you're trying to get the crash cart, you're trying to get something, you're frustrated, something is stuck, something is not working. You look up and you see relatives, family members standing, asking questions, people crying. There's so many things that are going on. A lot of persons are scared, worried, and sometimes you're just feeling so helpless. And in that moment, you realize that it's not about you. It's about the family. It's about the patient, and you're doing everything that you can to help them. All of that stress is on you as the nurse. It's on you as a person. And just think about it. You have to go home and deal with your family and act like it's normal. You understand? So those moments teaches us valuable lessons, and as nurses we have the power to make a difference, and that is something that I like about this job. You have the power to change lives, you have the power to comfort family members, go into different communities, make a difference. And so if I could go back in time, I would tell myself, to be a little bit more prepared. I would tell myself to be a little bit more aware of some of the challenges that are ahead. I will go ahead and tell myself to prioritize a little bit more self-care, taking care of myself, and not be afraid to ask for help when I really need it. Tell myself to always remember why I became a nurse in the first place, and that is to make a difference. So to all the nurses out there, or to persons that are aspiring to become nurses, I want us to go ahead and start from early to prioritize. Be prepared for the challenges of a lifetime, because you're going to be working real hard. You understand? Be prepared to cry, scream, and laugh, and just be prepared to make a difference in the lives that you may encounter on a daily basis. Just go out there and be the change agent. And remember, you're not always alone. You have other persons there. If you need somebody to talk to, you can always go and talk with them. You have friends, you have colleagues, you have family members. Try and always find a support system. Whenever you need a shoulder to cry on, go out there and cry on the shoulder. You understand? But don't feel as though you're alone. All right, so those are just some of the things I wish I had known prior to starting nursing. If you have anything else you want to add, go ahead and leave it in the comment box below. But as usual, thank you so much for tuning in, and I do hope that you enjoy the content. If so, give the video a thumbs up, a like, a share, and remember to subscribe to the channel for more. All right, until then, bye.